seconds to load. I'll tell you in just a moment.
I don't know what to say. They're loading it on YouTube, so I don't.
Let's make sure we're all unmute.
And we are live.
Okay. Good afternoon. This is Representative Ann Pugh, Chair of House Human Services, and this is our committee discussion March 31st on first Woodside and then foster care and residential programs as we need to move forward in the short and then near term in terms of COVID-19. Ken, I believe that you are first up. Commissioner Schatz.
Thank you. Good afternoon. I am Ken Schatz, Commissioner of the Department for Children and Families. Glad to present to you information regarding, in terms of this afternoon's agenda. It's primarily related to our Family Services Division.
Oh, sorry, Ken, that's my fault.
And sorry for that feedback. With me is Christine Johnson, who will also testify with respect to the areas you asked us to cover. The plan will be, I will start out by addressing the issues related to Woodside and follow up with a little bit of information regarding parent-child visitation. And then Christine will follow up to supplement my comments and also give you more information about our foster care and residential programs. So to start with, again, we talked this morning about the impact on COVID-19 regarding DCF as a whole. Obviously, with respect to the Family Services Division, it is, of course, particularly intense in terms of acknowledging the impacts and trying to maintain our child protection, child welfare, and youth justice systems in light of this crisis. Again, our staff have done a tremendous amount of work to try to serve the children and families that we support. It has been not without some significant challenges, to be sure. So to jump right in without taking too much time by way of introduction, you asked about Woodside, and you probably know that on Sunday, March 22nd, DCF was approached by the Department of Mental Health with a request to immediately utilize the building in Essex that is known as Woodside. What the Department of Health needed in light of COVID-19 was an ability to have a separate site as an emergency response to adult psychiatric patients who became COVID positive. We recognize that that was a very significant need in our community, that with only 4 kids at Woodside, in effect, it was an underutilized building, and that this approach made sense so long as we could find another site. People in the agency, within FSD, and actually Northwest Counseling and Support Services, NCSS, stepped up and identified a site in St. Albans that came to be known as Suite 12, which was identified as a site where we could house kids in a staff secure facility at the present time to meet this need. Frankly, it had some advantages in terms of maybe more flexibility in terms of meeting other needs that we might have with respect to placement of kids in light of the crisis relating to COVID-19. So we basically quickly moved to the kids who were at Woodside to this new program. Our staff who were formerly at Woodside moved to this program. In effect, we temporarily closed Woodside for youth. It is now, in fact, being close to being ready by the Department of Mental Health to receive adult psychiatric patients as the need arises with the expansion of people who have COVID-19 symptoms. So with that, we did, in effect, quickly create a new program. And we moved very quickly and in fact have discovered that we have challenges that simply were not foreseen, and we need to make some additional changes. The bottom line is that as a staff secure program, we had hoped that we would be able to provide enough and adequate supervision for the youth that we were coming into contact with. But in the last couple of days, there was an escape by youth that has caused us to quickly reconsider. And quite frankly, what we've decided that we had asked the landlord if we could put locks on the doors and alarms on the windows, but the landlord did not feel like that was appropriate for this building. So that approach did not work. Consequently, we are, as we speak, looking for another site where we would be able to have the capacity to lock the doors and windows to make sure it is a more secure facility. So that's where we are right now. We have, I believe, 4 youth currently in the program. And we are, as I said, looking for a facility that is more consistent with our needs. And we're going to move very quickly to make that happen. So let me stop there, Representative Pugh, and before moving on to parent-child visitation, might make sense for me to ask if you have any questions.
Thank you, Commissioner. And I see 2 hands up, but they've been up for a while, so I don't know if that is for you. Sandy and Carl. Sandy, do you have a question? Nope. Carl, do you have a question?
No, I don't. I must have left it up by accident. Sorry.
That's okay. Sandy? Okay, Mary Beth.
Yeah, just a question about the youth who escaped. Is that person back in custody? And, just curious how that ended up.
Sure. So there were 2 youth who escaped. One of them is back in custody. The other is not. And we do have alerted law enforcement, and they are in fact on the lookout for him.
And Ken, as you, if this is a question for you or for Christine, there were 4 youth who were initially brought up to suite, whatever it's called.
Suite 12, yes.
And there are 2 left there now. 3.
No, there were 4 originally, and there are 4 there now. And so we've had 1 youth return to home, and we had the 2 youth run. So we have 4 total there today.
And in thinking about the youth, are they corrections involved youth?
Yeah. One is a youth under the custody of the Commissioner of Corrections.
And was that the youth who ran away, or is that getting?
That it is not.
Okay, thank you. Are there other questions for Ken in terms of this overview right now?
I just had
Go ahead.
one more quick question, which was, you mentioned that Woodside staff have gone up there to be there. I was just curious, like how many staff is it, and that I would assume it's part of the staff, and what's happening with the rest of the staff.
So it's all of our staff was transferred. The Department of Mental Health facility will be staffed by Department of Mental Health employees, not DCF employees. But I will say, as a bit of a segue, let me be clear. One of the impacts of COVID-19 is on staff. So we have a significant number of staff. I don't believe very many of them I don't think any of them actually have been identified positive, but some get worried about any sense of a symptom. So some of them are self-quarantining themselves. Others have children at home where it's, for one reason or another, they're not having the child in childcare. So honestly, and we're not alone as a state agency or any business for that matter, who is operating even under the stay-at-home directive from the governor. It is a challenging situation for us with respect to have enough staff to meet our needs.
Thank you. And we have a question from James.
Actually, it's not a question. I don't know who was talking off screen where Commissioner Shates was. So I'm assuming that a lot of other people may not, especially online. So just what we talked about the other day about identifying, because I don't know who it was.
Oh, okay.
Oh, I'm sorry. So Christine Johnson did supplement my responses. Thank you, Representative Gregor. I appreciate that reminder.
Okay, cool. Are there, okay, I mean, I think, Ken, whether it's today or later on this week, what is it that you need from the legislature? As you said, we need to sort of regroup
Right.
about this short term, this immediate plan.
Right.
But then as we move, we're thinking about then the near term as opposed to the long term.
Yes.
Around the kids who kind of youth who would be at Woodside.
Right. So as you, I think, indicated, Representative Pugh, we're dealing with the near term. We'll be glad to keep you informed and advised about what's going on. And with respect to the long term, Christine will talk a little bit more about that when she testifies. But the reality is the short story is we're continuing along the path of recognizing that we do need 3 to 5 secure beds, and that we think we can manage that. And we are continuing to work with providers to create that type of capacity consistent with our proposal to close Woodside at the end of the fiscal year. So we will continue to keep you informed of that.
Thank you.
You're welcome.
Folks, if there are committee, if there are no other questions right now related to Woodside, we can move, Ken, we can move on to agenda item number 2 in terms of both the update where we are as well as near, immediate and near-term responses around foster care,
Yes.
as well as residential.
So thank you for that. So I will start by saying that, again, with respect, we are not making asks today. We are continuing, as we discussed this morning, with respect to childcare. It's the same situation from a financial perspective. Clearly, we are having challenges. Clearly, you can expect a request for supplemental appropriation. We're not there yet, because in terms of making this specific ask, because we're still in the throes of making plans to deal with this pandemic. And so we're definitely appreciative of the question and plan to get back to you later with more specific asks. I would lead in, though, in terms of the questions about foster care and residential programs, as I indicated, with some discussion about parent-child visitation, because that has been an incredibly difficult, challenging situation for us. We are very mindful of the guidance of the health department in terms of social distancing, limiting contact, urging people to stay at home, and how that impacts our whole system is significant. But one of the most obvious challenges is this question of in-person visitation between parents and children. By way of a starting point, with respect to our Family Service Division staff, we're working almost all remotely. We're doing as much as we can on the phone, through video conferencing, et cetera, to absolutely minimize in-person contact. So with respect to parent-child contact, again, this is really hard for all of us, because we really appreciate, even as we are involved in CHIN's proceedings, that it is really important to enable parents and child to have ongoing communication, ongoing contact. It is emotionally important for both the child and the parents. It directly impacts the capacity for reunification. Any number of reasons why I know you understand how important parent-child contact is. Having said that, we then came up with an approach to try to urge parents and foster parents and residential providers to arrange those contacts in a remote manner through video conferencing or by phone. The overwhelming majority of families involved and providers were very willing to recognize this crisis that we're in and have contact be remote. A relatively small number of families did not agree, do not agree, very much want in-person parent-child contact. And again, I want to emphasize how much I appreciate and respect that desire. But having said that, we were really concerned for the health and safety, not only of the child, but also the parents, the foster parents, the family service workers, and anybody involved in transportation or supervision of parent-child visits. And so, as you may know, we did make a request to the Vermont Supreme Court that in-person parent-child contacts be suspended during the period that the governor's stay-at-home order was in effect. We did hear from the court yesterday. The court denied that request and instead said, in effect, in any circumstances where there are issues, those should be brought on a case-by-case basis to the attention of a judge. So that's the approach we're taking right now, to work with our staff, work with foster parents to understand, and obviously families, and if there are concerns about risk and safety, we will be going to courts on an individual basis with respect to the potential or the request in those cases to suspend in-person contact. Again, it's just incredibly challenging. And it is one of those situations where I wish there was a better, easier way to deal with this situation or circumstance. We struggle because of this desire both to maintain contact, but also to support the safety of not only our staff, but other stakeholders and the population of our community as a whole. So I know you may have some more interest in that issue and discussion. I know that the president of the FFAFA, the Vermont Foster Families Association, Roland Forkey is scheduled to testify. You may want to wait until after she testifies to talk more about it, but I did want to address it very quickly with respect to my testimony here this afternoon. So let me stop there and see if you want to have questions for me or if you want to wait.
There are two people who have questions. I will let them ask them if it seems like something that we should continue with. I may go out of order and have Robin testify next. But in the meantime, Teresa and then Topper. Representative Wood.
Thank you. Commissioner, thank you for that update on what the court's decision was. I'm just wondering, I have had communication from I think 3 people now asking us, I understand that in Vermont, the governor doesn't have the authority to make some sort of emergency change in that, and ergo why you went to the Supreme Court. So are you thinking about any kind of emergency legislative response that you might be requesting?
So we are definitely thinking about it. Obviously, we just got the response yesterday from the court. So we're certainly talking about it. As you indicated, Representative Wood, the legal advice that we've been given is that under current Vermont law, that it is a decision by judges with respect to parent-child contact. And so, yes, we're certainly talking and thinking about whether we would make a request. Obviously, we're prepared to answer questions you might have about that.
Thank you. As you've already enumerated, the people who have contacted me are just really concerned about safety and the health of their families. I've been contacted by foster families, and of course of the foster child, not knowing what kind of adherence to the social distancing request that's been made, whether or not the other family is taking that seriously or not. So very much appreciate your attention to this. Thank you.
Topper, Representative McFawn, and then James, Representative Gregoire. Topper.
Commissioner, have you had any cases at all that have used the system of going before the judge?
Yes, we have. There have
How
been,
long does that take?
I'm sorry.
How long does that take to get
I
a decision?
do appreciate your question. I don't know off the top of my head. The court is still hearing emergency orders, including these cases. I know that at least one example of a case where it was heard relatively quickly, but I will share that I have heard concerns about the timing with respect to the scheduling and determinations of these cases in light of the court's suspension of many activities. What we've talked about internally, assuming we're going this route of case by case, is wanting to make sure that between our staff and our attorneys, I and Christine are kept informed about the status and timing, so that if we need to contact the judiciary to urge there to be a quick response, we're prepared to do that.
Okay, and my last statement is the timing and all that is important, but I think the impact that has on the foster parent and the child is equally important.
I do appreciate that. Thank you.
Thank you. Representative Gregoire, James.
Yeah, really, it's just reiteration of the last two representatives I've heard from constituents, foster parents, and other legislators have asked me to pass along what they've heard, which is exactly what Representative Wood has been hearing. And so you already know that, but I just wanted to let you know there's more.
Well,
I do
mean,
appreciate that. And I do want to, I realize I didn't say it, and I want to be clear about something because it's a reflection of how hard this challenge is. That, as you of course know, every state has a similar child welfare system. States are dealing with this very differently all over the country. There are some states that have suspended for the time being in-person visitation, but others that are looking at this case by case. I also want to be clear, the federal government through the Children's Bureau did issue a guidance late on Friday evening saying that they recommended against a blanket suspension of in-person contact, instead urged states to look at encouraging remote contact, but trying to find safe ways to have in-person contact. Now, candidly, as far as I can tell, there is no safe way to do it. You clearly will increase some level of risk. But again, I just want to be straightforward with you and fair that this is an issue that is challenging for communities all across the country.
Ken, thank you. And thank you for mentioning the complexity of the situation and the different views on it. Although it's probably on some level, maybe for some of the residential programs, some similar issues, but rather, Bethany, if it's all right with you, I'd like to have Robin go next. Do you have, and have Robin Sweet, who's Vice President of the Vermont Foster Adoptive Families Association.
That's fine.
Go next. Thank you.
Thank you.
Go ahead.
Thank you. I'm Robin Sweet, Vice President for the Vermont Foster Adoptive Family Association. The board of VFAFA, as we are commonly known, is very appreciative of the opportunity to speak with you all today. These are unprecedented times, and as New York Governor Cuomo has said earlier today, we need every citizen's full cooperation for social distancing. Everyone needs to be doing their part. Stay home, stay healthy, and stay out of the hospital. The request has been made to all Vermont citizens to do our part to stop the spread and flatten the curve for the sake of our healthcare systems and those who will need higher levels of medical care. This is a war like none other in our lifetime. Medical professionals are our military on the front line. There is no way to know who is going to get COVID-19, how their body will respond. Will we be one of the lucky 80% with milder symptoms, or will we need higher levels of care? Our essential first responders continue to take the necessary risks to help others. What we're asking for is to recognize that these risks are very necessary for our foster parents as they perform first responder duties in caring for these foster children. One risk we feel is not necessary for the biological families, the children, or the foster families is continued physical contact. While we understand the bonds this contact brings, it is not necessary for it to be done in person, but rather these bonds can be maintained with virtual contact. What we need from you, the lawmakers of Vermont, is emergency authority given to the Vermont State Governor to act on behalf to halt all in-person physical contact for the children who are in the custody of the state of Vermont and living in these foster homes. Some foster families are still accepting new children into their homes. All of us are now managing distance education for children in our care. We're working through the changes of virtual therapy, disruption of our daily routines. We understand what that looks like for our children in our care. We do not take this lightly. We understand that adding virtual family time for our foster homes actually may create more work for us. But we know that it's the right thing to do for everyone's safety. Asking for the halt of all foster child, parent-child contact physically is not something we take lightly or just on a whim. We want this to help stabilize children in the homes where they currently live. Some having joined a foster home a few days or months ago, and some having had lived in these foster homes for over 3 years, while still in the custody of Vermont. Foster homes are voluntary. Currently, foster parents have no rights for their own protections unless we want to withdraw their home from service, which they can do at any time, but where does that leave the children? These children would then be moved from a home they know. DCF also feeling they have limited options these days, in some cases reunifying children when this occurs, while for some that is okay and right, it is risky for others with no school, childcare, social workers, or services with eyes on for the state's children. We need to allow foster homes to feel their rights are also protected. The right to protect their family by social distancing and stay at home, stay safe orders. We want to continue to care for the children in the state custody that are placed in our homes and support them through these uncertain times. Foster parents do not want to keep the children from seeing their biological parents. It is the opposite in most cases. We feel strongly that the importance for the children in our home to have healthy attachment to their biological parents. We know that it is important for their whole life. At this time, the best way to meet the needs of continued contact for biological parents and meet the needs for foster families for the children's living stability is to have all physical contact changed to virtual contact. Well, this isn't ideal, and we understand that. It is how we are keeping contact with our teachers for education, therapists, and others. The children can understand this message, and we can assure them that this is for a period of time. In the majority of cases, digital contact for short term will not disrupt attachment or eventual reunification, if that is the plan. While DCF has worked with biological families to ask them to change to virtual or video time with their children, under the current court orders, this is voluntary. Many biological parents see this as important for themselves and their children, but some families have been unwilling, meaning the children are leaving the foster family locations where they are under the stay at home, stay safe order to head out to visitations. This causes foster families fear and uneasiness as they can never relax and pass the 14-day incubation period of COVID-19 for their families. And as the children may come and go regularly, they have zero control over the exposure the children will have while with their biological parents. The protocol Judge Grierson has spoken about regarding emergency motions being filed for judge's review on each individual case is not working for everyone. The courts are backed up as motions sit on court clerks' desks if they've been unable to process motions while working remote, and reduced staff is making it difficult to move on even emergencies through quickly. which is not being seen or heard for up to 2 weeks. The foster families have no option but to wait and hope that the judge will see the order soon and rule to allow virtual time. The volunteer foster parents are at the system's mercy. It's time to show the value of the foster parent volunteers to stabilize the children's place in homes, especially with new demands of distance learning, and maintain the foster child's parent contact through virtual means. We should not feel dispensable. You are going to need foster parents to be willing to continue to foster now and in the future. This is for the safety of everyone. Please give emergency executive authority to Governor Scott of Vermont so he may make the declaration for Vermont to halt all in-person parent-child contact for children in the custody of the state of Vermont living in foster homes and initiate virtual parent-child contact for those foster children. We are asking this order to follow the stay-at-home, stay-safe order, whichever shall expire later. Thank you.
Well, thank you. Thank you very much, Robin. And know that your email that you sent to the legislature was read by folks, and most people know that.
Absolutely.
Are there other questions for Robin from the committee? Robin, thank you. Please know that this will be something clearly that both with the department, others trying to figure out. It is clearly complex, and as with everything in the world of child welfare, there's no necessarily one right way to do it, but we certainly will be looking at this very seriously on how to protect the foster parent system, protect foster parents, as well as figure out how to maintain contact. Representative Wood, Teresa has a comment or question.
Thank you, Madam Chair. Just a quick question for either, I guess, Ken, Christine, or Robin. Do you know what the number is or what the ratio is of the number of families who have not agreed? So we get some idea of the breadth of what the issue is.
Good question.
I do not know that number. I just know that I've received multiple messages, either via text, phone call, or emails from a number of foster parents saying that they're having that problem.
Hi, this is Christine Johnson. Can you hear me?
Not too well. Not at all.
I'm in the same room as Ken, so I'll just kind of put my head over here. We'll play musical chairs. So our, I think the number of families that like to have in-person visitation is approximately 30. And we have 1,200 kids in custody.
I can't hear Ann.
What? I know. Ken?
Ken's
we're not
microphone's
hearing
not on.
anything.
There you go.
Okay, there. Can you hear me now?
We can.
Okay, great. Christine Johnson, Deputy Commissioner with DCF Family Services Division. Just wanted to let you know that we had approximately 30 families that wanted to have in-person visitation. We have just over 1,200 families, children in custody. Not all of them are in foster care, but we had approximately 30 that requested in-person visitation.
Thank you, Christine, for that answer. I think one of the things we'll be looking for is, do foster parents know who to call? It's good that they call Robin and let you know, but if they know that this is going to be an issue, hopefully they can call, they know to call their foster parent support person.
Yes, we have resource coordinators in every district, as well as recruitment and retention specialists, and we do expect that they'd be engaging with our staff as well as social workers. So there certainly are resources that foster parents can reach out to.
Might be helpful to reinforce that, although it is only 30, but somehow to reinforce what the process is right now. as we begin to continue. But thank you. Other questions for Ken or Robin or Christine around the foster parent concern? Representative McFawn, Topper. Topper?
Yeah, I just wanted to mute my thing. Unmute it. It appears to me, all of that is good to have the resources and who they can call and all that. But it appears to me that it's gone beyond that now, that they have a ruling from the Supreme Court saying that you got to go before a judge. So it's in place. So these people are trying to follow the ruling that they have now. The ruling is the problem. So I think that's something that we need to look at.
Okay, yes. Ken, it looked like you unmuted yourself. Did you want to add something?
No, I was thinking that there was going to be a question for me, but it sounded more like a comment, so I don't need to add.
If you know the answer, we had asked, but clearly he was probably testifying in front of another committee or being in court. We had asked Judge Grierson to be here. But what does the process go to an emergency hearing? Does someone have to go to court? Is it a piece of paper? How does that work?
So generally speaking, it would mean that a motion needs to be filed with the court. If, for example, in these situations that we're describing, that would either be done by an assistant attorney general assigned to the Department for Children and Families, or it might be a state's attorney who also is involved in these CHINS proceedings. But basically, we would file a motion. The court is doing everything through video conferencing or telephonic communications. So it is likely that the other parties would be notified, but there would be some type of remote type of hearing would be my expectation. But again, judges would deal with this in their own discretion.
Okay, thank you. Clearly, we may need to hear something else. Robin, I'm really we don't really have the capacity to go back and forth, but please come back on and say your question or comment.
So I just wanted to reiterate with the going through the court process is that some of these foster families have done through their AG office, filed that motion for there to be virtual visitation, and that initial hasn't been heard and it's been on the court clerk's desk for 2 weeks. And during the period of time when the hearing has not happened, those visitations in person have to go forward. Otherwise, the foster parent is in violation of the court order.
Okay, thank you. Yes, thank you. Thank you for reiterating that. And I know that you wanted action when you sent the emails on Friday night. You wanted action, and the kind of action that you wanted immediately, unfortunately, there is not the opportunity to happen immediately, but we will be looking at this. Thank you. Bethany. Bethany is the director of the Vermont Coalition of Runaway and Homeless Youth Programs.
Thank you.
Hi, thank you, Bethany.
Yes, thank you. Thank you all for your time and attention. I think Julie is sharing the written testimony that I provided, and I will start with that and appreciate all of you adjusting so quickly to our new working modes. So thank you for the opportunity to speak about the impacts of the public health crisis on VCRIP services. VCRIP is our acronym. And the young people we are supporting. A brief reminder about our scope of work. VCRIP is a coalition of 12 members and partners who provide housing, shelter, and crisis supports to youth between the ages of 12 and 24. I'm listed under residential programs section on your agenda, and we do have 3 sites providing transitional housing services to older youth in congregate settings. And one of those sites is also providing services to runaway and homeless minors and youth in DCF custody in a congregate setting. We have a fourth site that is providing congregate emergency shelter to older youth. So we do, and all of our sites are licensed to do host home provision for minors, but that is generally not congregate. So I will speak to some of the issues that we're seeing in congregate care. And I will also just take the opportunity to speak about some of the other challenges we are facing as well.
Bethany, please do. That was on some level shorthand on our part. And I know that you are speaking for the entire coalition. So the fact that the coalition is made up of a diversity in terms of supporting youth in crisis, it's important. Thank you.
Thank you. So our current state of operations, our transitional housing program sites are all still operational, and those sites that are using a scattered site model, which is units, apartments, community-based apartments that only house one household, they're still accepting youth and new clients into services. Transitional housing sites that were congregate care are taking youth in on a case-by-case basis, using screening tools to assess the risk, but concerned about the inability to isolate youth for 14 days to limit exposure to other clients. Measures have been taken to increase disinfectant and protective protocols in shared spaces, but isolation or quarantine in these units would mean a client is confined to their bedroom, but there's still a shared bathroom and kitchen, so it's not ideal. And so there's certainly some increased risk in our congregate care settings right now. Rapid rehousing vouchers are still being issued. These are going to be one household per unit. And we're still able to get referrals from the coordinated entry system, but some youth are having a hard time getting the necessary income verification from employers who aren't available right now or don't have access to documentation. And housing search is also complicated as landlords are limiting exposure. And if a unit needs to do work to pass the high level of the housing quality standards inspection, finding workers to do that can cause delays in a youth being able to access that unit and move in with their voucher. Whenever possible, we're extending deadlines and we're working with our funders, our federal funders at HUD to address the new complications that are arising. And HUD is looking at doing a waiver on housing quality inspections and instead using the lower housing safety inspection, which means that there doesn't need to be a central light in every room and some of the things that that are necessary for that housing quality inspection. Emergency shelters for minors is primarily provided by a network of host homes, which are community members who share their home with youth in need for up to 21 days at a time. This network is certainly compromised across the state right now. We're operating at about a 60% capacity. Many of our host homes were empty nest parents who now find themselves living with their children again, or Vermonters who are self-isolating and have stepped back from shelter provision. Agencies who aren't able to shelter a minor are working with the youth and families to identify other housing options and still providing family reunification services. We've moved most of our services into more of a telehealth model and doing virtual meetings. Agencies across the state are working very closely with their local continuum of care to address individual youth needs as they come up and see if there's alternative placements for them than congregate care settings. We're working to put protocols in place around moving a symptomatic client into a recovery bed and exploring the use of hotels for 2-week isolation stays before moving into congregate care settings. We'd like to take a moment just to thank our partners at OEO for their incredible efforts in responding to the emergent needs and putting resources in place. They've been moving very fast, and we really appreciate all of their efforts. The direct impacts on youth and young adults are starting to show up. Starting the late last week, our agencies began experiencing increased referrals for services. Young people who were struggling before have exacerbated challenges and are now losing housing. We are seeing an increase in calls from both minors who are in place with their families, but who have heightened conflict as the pressures of the pandemic take their toll, and young adults who were struggling to live independently without adequate resources before, and who are now some of the first to be laid off from their jobs and kicked out of a home where they were couch surfing. For youth that are already in care, VCRIP is fielding requests for emergency supports to respond to their new needs which are often not supported by our funders, like medicine, phones, data and minutes for those phones, emergency supplies like food and cleaning supplies, and Wi-Fi, so they can still participate in their education and still maintain social connections. We anticipate that as the pandemic continues to unfold, these concrete supports will continue to emerge. We're also worried about the longer term move on strategies. When will youth be able to exit services? For all of our housing supports for older youth are time limited, and depending on the length and severity of the crisis and unfolding economic repercussions, young adults may not be able to rebuild resources before their length of stay is up. And currently there are no permanent housing move on preferences from Vermont State Housing Authority for youth served in VCRIP's Rapid Rehousing Project or the Transitional Housing Project. Impacts on the financial stability of providers. Like all small employers right now, our nonprofits are worried about the long-term financial impacts. Reserve and unrestricted funds are being eaten up by paying for increased tech needs for remotely working staff, stocking up on supplies and food to support youth in care, paying for hotels or additional housing units that weren't budgeted for to accommodate isolation and quarantine needs, and continuing to pay staff wages while billable services decrease. With unobligated funds going to unanticipated concrete costs, some agencies are becoming worried about being able to meet match requirements for federal partners, or about drawing down full contract amounts if they don't meet targets. So I think we're just at the beginning of seeing what some of these longer term impacts will be. So thank you for your for your attention now, and we look forward to the opportunity to evaluate the ongoing impact with you.
Thank you. Oops. Thanks. Committee, who has a question? Bethany, I do. You talked a lot about and gave some really helpful information for us. What would be the top 3 things that are needed? Short term, immediately, and then short term? Is it money? Is it policy? What is it?
Right now, we don't have any policies creating additional barriers for us at this particular moment. So right now it would be concrete supports and so some financial support for emergency costs that are coming up, and for staff support costs. Like now we have to pay for Zoom accounts, and we have to make sure employees have laptops that they can work remotely on. And so there's a lot of unanticipated costs that are coming up, both direct service costs, but also administrative costs. And so resources for those would be greatly needed. I think if you know, funders and people who influence funders have any ability to you know, just look ahead at what it might mean if we don't meet targets, or how we pull down our funds for pay for fees, you know, services, and the model that we've moved to, that if there's flexibility within those systems to reduce targets or to continue to fund based on what the average for the previous 3 months were, instead of what this month will be and next month will be, those kinds of accommodations would be very helpful.
Bethany, thank you. Committee, anything else? Bethany, thank you very much. And thank all of the people who are within the coalition and the families who are being the homes. Oh, and see, I talk and there is Representative Haas. You have a question.
You mentioned meeting targets in order to not lose your funding. Is that primarily federal federal lines of funding, or does that include state?
That does include some state lines of funding. A lot of our services are braided with DCF prevention and stabilization supports for youth and families, that contract. And I know that there's some concern there about meeting targets.
Thank you.
Okay, thank you very much. Next up, we have Dave McAllister, Director of the Laraway School and Treasurer of the Coalition of Residential Youth Programs. Dave, please go ahead.
Hi, thank you. Good afternoon. It's a pleasure to meet all of you. I wish it was under different circumstances. I'm a big handshake guy myself, so I'm giving you all a virtual handshake there. I am the Executive Director at Laraway Youth and Family Services, and also serve as the President and Treasurer of Vermont Coalition of Residential Providers. I think, you know, in order to have a decent conversation here and keep it succinct, because I know we're on time restrictions, I think it really comes down to three things from our perspective, and that is how has this COVID-19 impacted our kids and families, our staff, and certainly the organizational sustainability and financial viability of the work that we all do. So what I've heard from feedback from a number of our different programs, and I will generalize as well as not just make this about Laraway, but I think, you know, Ken led off talking about the impact of some of the family visitations and this difficult situation. And I would say that the feedback that we've got from programs is that there are some kids that are embracing, you know, the limits that are there in front of them. And there's some other kids who are having a really hard time with the lack of physical contact and connection with their family. And in some cases, that's meant that transition plans were put on hold because they weren't quite ready, you know, mom or, you know, family or kid. And so those things have been delayed, or in some cases, it's just, you know, the regular routine contact of seeing the beloved one. So that's definitely been an impact. I think the other major impact on kids has been just the community restrictions that have been placed on programs based on the stay-at-home mandates. A lot of the programs that we have, although they're quote-unquote residential programs, they're all very much community-based and rely on a lot of the community resources to engage kids in treatment activities. And so with the restrictions to, you know, the pools, the gyms, some of these other sources that are relied on for kids' care and kids' treatment and kids' activities, I think people are really grasping with how to best support the kids. I know specifically at Laraway, we have a lot of kids in our program. We enroll in martial arts classes, yoga classes, things like that to work on their treatment. And of course, those things have all been suspended. And so, you know, I think kids going without some of those resources has impacted things there. The other major concern I think that is growing is just, you know, we've had a wonderful partnership but we also have incredible
Dave, we have lost you. The wonders of internet connection in terms of the hearing.
Okay, I'm sorry. I got cut off the stream there. We also have an incredibly, oh, can everybody hear me?
Now I can hear you.
Okay, all right. I'm sorry, must be the bandwidth is being maxed here.
Yeah, I'm sure.
So I do think that, yeah, I think one of the major concerns is that, you know, although we've had a very limited, you know, system of care over the last few years as we've sort of become, you know, resource limited, we've also had mechanisms in which we can support kids when those higher level and higher needs arise, and whether that's a behavioral or mental health crisis. And so I think right now there's growing anxiety about how this sort of system lockdown is really going to impact programs and kids and milieus when those situations arise. So I think that that's kind of an unknown right now around the kids. In terms of the staff, I think the general consensus is that there's a lot of committed and dedicated staff that are showing up every day and doing what they can to support kids and families. I think there's a pocket of staff who have elected to self-quarantine or not to come to work because of their growing concerns and risks of whether that's exposing themselves due to health reasons or exposing their family or their loved ones. And so those decisions have left a lot of programs in some staffing shortages and some issues right now that have forced people to do some creative and unique scheduling. I know, like the residential programs with the closure of school, now they've essentially adopted 24-hour, 7-day care with not necessarily the resources available to do that. I know in our case, we often run understaffed as it is when we didn't have to care for the kids, during the school day. And so to be able to cover that as well as, the after hours care has just been taxing on the system. So I think that there's that growing concern as well that, so far I haven't heard of any illnesses, exposures, or sicknesses from, kids in programs or staff in programs that have come back with positive tests. I think the major concern is that all of a sudden, if you have a kid who's ill and is confirmed, now is the staff going to be willing to show up and come to work? So that becomes, I think, a major concern there. And then the third thing I think mostly is around the financial security and stability. As many of you probably are aware, we have an incredibly complex system of care, and we have a lot of beautiful collaborations and creative and innovative programs that are funded and run through our DCF and DMH and AOE partners. The challenges with that is that they all seem to have some unique caveat to funding, and in some cases, the PNMI system in particular for a lot of our VCOR members is problematic when it comes to these types of circumstances, because their funding is directly connected to their bed days, and it's a rolling average, and there's a plus or minus margin, at the end of the year based on their expenses or deficit surplus ratios. And I think right now people are incurring a lot of additional expenses as a result of this, and whether that's again directly connected to the staffing hours that budget, it's kind of personal protection equipment, it's directed to cleaning supplies, the increased technology costs. I know for us, we had to go out and buy all these personal devices, kids, to be able to do remote learning. We had to hook up phone lines, hotspots, et cetera, for staff, and provide a lot of devices to staff on the education side that don't normally require them, just in order to meet those requirements. So I think a lot of organizations are incurring a great deal of increased expenses in preparing to not only provide but support the technological requirements here as we move forward. So I think, if I had to ask anything of you today, I would say, for what level of it that you control, to try to be as creative and flexible as possible in the funding teams over the next few months, and allow the programs to be able to access those funds that they need to sustain. Again, I look at, our budget right now. We don't have the ability to intake a lot of new kids, to manage referrals, and those sort of things. So we're pretty limited in terms of the revenue that we're able to generate in order to cover our costs. You know, we haven't laid anybody off yet at Lara. We're very committed to our staff. We'd love to figure out how to keep everybody engaged and supported. We're looking into the SBA loans and some of these other things from the federal package. But at the end of the day, you know, if we're able to keep our revenue streams flowing and provide services to kids, then that allows us to just be able to do the work that we need to do and keep everybody whole and safe and secure along the way.
Thanks, Dave. We've got some questions, and the first is from Representative McFawn. Topper.
Thank you, Madam Chair. I just have a quick question. I'm not as familiar as I probably should be with Laraway School. Do these kids come and go every day?
Yeah, so Laraway Youth and Family Services, we're really three major departments. Laraway School is just one of the departments that we operate. We generally serve between 37 and 40 students. Some of them are day treatment students, so they come in from their birth families. They're sent to us through the local education agency, and you know, we provide special ed and clinical support to them in their educational pursuit. We have two other departments. One is our backpack program, which is a school-based intervention program where we provide staff in public schools supporting kids that have higher needs, along with case management to support their families and consultation to develop behavior plans for both our school and family partners. And then our substitute care program, which is our residential and our therapeutic foster care program. So those kids are with us all the time in one of those capacities.
So do those kids, do they intermingle? The ones that come back and forth every day, do they intermingle with the kids that are in the foster care part?
Sometimes we have probably at any given time just under a third of the students served by Laraway School are also in our therapeutic foster care program. But our therapeutic foster care program extends several counties. So we have a lot of kids that are in foster care or residential that actually attend public schools. That's a decision made by their LEA.
But right now, they're not going to public school.
Sorry, go ahead.
I was going to say, I'm trying to be clear. Right now, they're not going anywhere, is what you're saying. They're not going to school.
No, right now, all of our students are under the same mandates that that Governor Scott issued with the school dismissal. So any of our kids who were in public schools are working at home in their foster care system with whatever the technology that was provided by their public schools. Any of our students that were attending Laraway School, we issued our own Chromebook devices, and our teachers have developed a Google Classroom platform, and they're serving those students just the way that public school teachers are serving those mainstream students.
Thank you. Thank you, Dave. Christine.
You're welcome.
Thank you. Christine, when we look at the entire residential system, how many kids are we talking about? Are we seeing, from the state's perspective, out-of-state kids need to figure out what we're doing with them? How are we planning for that? And how many are residential programs releasing kids? That's one of the rumors that we're hearing. Can't hear you. Can't hear you. Oh, now we can.
Okay. Is that better? Okay.
Yeah.
All right. So thank you for that. I sent along a handout that is going to address some of the in-state residential capacity, but let me just start by answering your question by saying that
Of course, COVID-19 is causing many residential programs in Vermont, but also in other states to reduce their capacity due to staffing shortages. The handout that I forwarded on to you shows all of our in-state Vermont programs, shows you what the normal capacity is, and then also shows you what the reduced capacity is due to COVID. You can see, and I believe this was done about 5 days ago, you can see that most, if not all of our programs are completely full. Laraway Footbrook has closed. Woodside, of course, is closed, and we've reopened at Suite 12. Of course, remember, we had 30 beds, but we've only had between 3 and 5 kids at Woodside for the last 6 months. So you can see the pressures that COVID is currently causing. To Dave's point about regarding staff who are our capacity is reduced based on the fact that kids are being taught at school, and there's a lot of childcare pressures, and there's a lot of reasons for why we're seeing the reduced capacity.
So what's happening to the kids? Where are these kids who could not be at home before, who needed residential or specialized foster care? Where are they now?
Well, we're managing them where we can. So I think the increased pressure that you're seeing right now on Suite 12, where we're now at 5, we're at 4 today, but we have 5 beds there, and we're keeping those pretty full. I think that's an indication of where we are taking kids that are exerting this pressure. I also think that one of the things that we did, let me speak for a second about out-of-state residential treatment providers too, because they are a part of this equation as well. Many are no longer, actually most are no longer accepting new referrals. And many states have their interstate compact for juveniles and their interstate compact for the placement of children no longer accepting kids across borders. Many of these programs, including many of our programs in state, have committed to sheltering in place if they have COVID positive youth. And I also want to say, especially for Dave and others to hear through VCOR, in the event that a youth does become COVID positive and needs a place to stay, the Agency of Human Services is standing up the AHS Welcome and Recovery Center in Plainfield at Goddard College. And that is a place where we want to use as a last resort, but we are staffing it so that we can accept COVID positive and clinically diagnosed COVID patients and be able to assist our residential programs in that capacity as well. So I do want to say that on March 16th, there were 104 children and youth placed in in-state residential programs. And we asked Mel D'Amico and her specialized services unit to work on returning anybody home who was on the precipice of being able to return home anyway. So we now have, as of March 25th, we have 80 children and youth that are placed. So that is a reduction of 21 moves of kids that have been moved back to either home or to foster care. There were several planned moves that were expedited to make sure that residential programs could adequately staff the youth that were remaining in their programs. And I just want to point out that this emergency discharge effort included conference calls, treatment team meetings, education planning, and transportation efforts of our FSC staff and other community partners. And it was extraordinary, the work that they did to move these kids. The other thing that we did that we'll touch on, something that Bethany was saying earlier, is that I did provide guidance to our staff that they were to reunify kids with their families if children were already on a path to reunification, so that we could, again, respond to the pressures that we knew were coming in the foster care system. And of course, this was done because of COVID. I'm wondering if I've answered your question, other than to say that we are managing the kids that we have in the programs to the best of our ability with the current services and programs that we have.
I realize that everyone is doing the best that they can. I am hoping or assuming that with all that's going on and staffing issues, that there still is the ability for youth who've been returned home that they, in fact, there are people in the community who, by video or phone, are providing the support and that families and youth are going to need now that they are at home.
That is our understanding, Representative Pugh, that our staff are certainly available by telephone, by conference call, by Skype, and the whole variety of ways. We certainly are hearing from our community partners that they also are working remotely. We do know, though, that a lot of the physical in-person services are largely being done remotely, and we are concerned about the pressures that's putting on our system.
Yeah, I just, I appreciate you saying our staff are available. I have to say, my assumption is that kids who are and youth who are in DCF custody, who are returning home, not at the time of which they were necessarily going to return home, perhaps a little bit earlier with the plan speeded up, that in fact there is an expectation and clear directive that their DCF worker will be in contact on a regular basis to provide that support. And we'll need to know what you need to make that, enable that to happen in terms of workforce.
Thank you.
Are there, yes.
I just wanted, I know this might be a little bit off topic, but I think it's very relevant. I wanted to let you all know that today we learned that we have had a reduction of 60% of our calls to our child abuse hotline. That is a large reduction, but we have an increase in our accepted intakes. So historically, we accept about 30% of our intakes, and for the month of March, we actually have accepted between 60 and 70% of our calls have been accepted as intakes. So I just want to keep you apprised of, we know in Vermont and across the nation that there are fewer calls to child abuse hotlines. And I just want you to know that we're seeing that here as well. One other thing, a couple of other things actually, we are having conversations with our foster parents and our support staff for foster parents around the issue of respite. We know that that is an ever increasing area of need. So we're staying in communication about that. And we're also looking to see if there are ways that we can support foster parents financially with a stipend, especially to care for a child who is sick with COVID. And so those are some of the things that we're trying to do to support our foster parents, in this ongoing way. It's clearly multifaceted and difficult. If I could just add another, I keep thinking one or two more things, and then I see my list. We have extended services through our youth development program, specifically to older youth that have been in foster care or that are currently in foster care. The youth development program is providing case management and using their options to really help to meet the new needs of these youth. As you know, many may have been in a college, and when colleges closed, these youth may or may not have had a place to go. They may be struggling to find a place to live or to pay the rent. They may be struggling to financially support themselves if they don't have jobs. And so just a huge thanks to our youth development program and our staff who are really trying hard to reach out to this population of older youth and make sure that they have a safety net.
Christine, thank you. Thank you. And I would, making the same request of you that I did of the commissioner, which if there are things in the way that we need to think about in terms of policy changes or requiring you to exercise your authority under rulemaking. And one of the things, I don't know whether it makes sense or not, but we may need more foster parents. And is there a way of keeping that pipeline up? You have to answer that now, please, to deal with the pipeline and things. And we have two questions. We have one from Sandy Haas.
Sorry, I'm having trouble with the mute button. Christine, you have lots of information and you speak very quickly, and I was diligently trying to take notes, but I got lost. I was wondering if you could just put some of those bullet points that I don't need a speech. I just need a list. You gave us the 60% reduction in calls, but I thought you said that something was higher, and I don't know whether it was the ones decided for intake, but that's where I got lost. And back when you were talking about the kids that had been in residential and you gave dates, a number and a date and numbers and dates. If we could just have that in writing, that would be really helpful.
You bet, Representative Hawes. I'll get that to you. Thank you.
Thank you, Sandy. Dave, although we don't really have the capacity for conversations, I did see your hand up. So what did you want to add very briefly?
Yeah, Madam Chair, thank you. I just wanted to let everybody know that in my experience in 20 years of doing this work, we've never encountered anything to the magnitude of this. And I will tell you that the collaboration and the innovation and the flexibility with our state leadership has been remarkable through this. So I really want to say that our collaboration as programs with DCF, with DMH, and the Agency of Education has been tremendous. And that is something that, despite all of this negativity and fear and concern and worry, that is something that we should celebrate and keep our eye on. And to Christine's data there, the one thing I worry about long-term is the increased amount of domestic violence and child abuse that could come in. And I know that the intakes are up, the hotlines are down, if I heard her correctly. But again, a lot of the reports come from schools. If these kids aren't being in school all day, people aren't going to be noticing these things.
Okay.
So I think we just need to be looking down the road and prepared for that impact on our system of care when we resume some level of normalcy. Thank you for having me.
Thank you. Thank you very much, David. Committee, Marshall Paul is here and would like to add something to this conversation. Michael, you have less than 10 minutes. Marshall, I'm sorry. Marshall Paul? We can't hear you, Marshall. Can't hear you. I can see you.
I can't see him or hear him.
Still doesn't work, Marshall. Nope.
And you might have to unmute him.
He's not muted on my screen.
Oh,
I'd recommend that he log out and log back in. It probably will work.
I'll submit a written testimony. Okay, can you hear me, Marshall? The suggestion was just to hang up and try to log in again. Hang up and then log in again. Committee, while we are waiting for him, what have you taken away? Where, from your perspective, do we need to continue the conversation as we are talking about the response to COVID-19? James and Jessica. Oh, James, you took your hand. Okay. And then
No,
Jessica.
I'm ready though. Can you hear me?
I can, but okay, quick, because Marshall Paul just rejoined. We'll see if he can talk.
I'll wait. He can go.
Marshall, try again. Sorry, Marshall, if you are in, I can't hear you.
So can I go?
Marshall, I still can't hear you. Marshall, I still can't hear you, sorry.
How about now?
Oh, yes.
Sorry, this is my first Zoom meeting. It was connected to the wrong microphone, so I apologize for that. This is all
No
an
problem.
experiment for me. So thank you. I will be very brief. I know that I have limited time. I just wanted to address a couple of issues regarding visitation that were not brought up by other witnesses. I would echo most of what the other witnesses said. I think the one thing that really wasn't touched upon is really the importance of in-person visitation and the importance of making these decisions on a case-by-case basis. And I'm going to start with a caveat, which is that I completely agree with the other witnesses that it's very important that we come up with ways to have these case-by-case determinations about parent-child contact made in a manner that's expedient and in a manner that's safe. It shouldn't require everybody going to court. But I do think that these things need to be decided on a case-by-case basis. And the reason for that is that we have very, very strict law in Vermont about really how decisions are made when it comes to the end stages of a child welfare case. And unlike most states, in most states, there's a determination at a termination of parental rights hearing. It's a threshold determination. Before the state can terminate anyone's parental rights, the state first has to prove that the parents have had, essentially the adequate resources necessary for there to be reunification. And one of the primary resources that parents use for reunification is parent-child contact, in-person visitation. We're one of the only states that doesn't have that law. We don't have a law that says that, for example, if you, through no fault of your own, were prevented from having parent-child contact, and if that results 12 months down the line in you not having a particularly strong bond with your child, that can be a basis for termination of parental rights in Vermont, unlike other states. That's why it's more important in Vermont in very certain cases. And I'm not talking about most cases, but I'm talking about specific cases, really sort of high acuity cases that could go either way. Those are the cases where it's really, by saying we are not going to be having in-person visitation, we would essentially be saying to some of these parents, you are not going to be able to reunify with your child, and your child is going to end up having his or her parental rights terminated. And that's why the sort of level of angst and stress about this in Vermont has been different than it's been in some other states. But I think it's also important, you can see the same concern reflected in the guidance that comes from the federal government. So the Children's Bureau, through Jerry Milner, who's the head of the Children's Bureau right now, put out guidance that DCF touched on in their testimony, which very clearly said that, yeah, in a lot of cases, it's going to be very appropriate for states to move from, most visitation being in person to using technological solutions for that. But they were very clear that they're not giving anyone any leeway on that. They're not saying that if you have one of these close cases, if you have a case where in-person visitation is really essential to building that bond, that the feds would be giving the states any sort of latitude on that. And in fact, they mention in their guidance that really Title IV funds are tied up in this, and that states, part of how states get their Title IV funds is by complying with guidance from the Children's Bureau, and that they are strongly recommending that no state go down the road of issuing either blanket orders or summary orders cutting off visitation. And so we're strongly encouraging to keep on the track that we're on, which is we've already solved most of these cases. In most cases, visitation is happening remotely. It's happening using FaceTime, Zoom, all kinds of other technological solutions. In a very small number of difficult high acuity cases, we're still trying to figure out what the appropriate solution is. But if it goes down the road of there being some sort of a blanket order, it's going to cause problems with federal law. It's going to cause problems with constitutional law. It's going to cause problems with, frankly, with equal protection problems, because we see identical visitation orders issued in domestic docket cases, coming out of divorce and parentage cases, in probate court cases that come out of allegations of child abuse and neglect, and in Chin's cases. And it would be really a matter of equal protection and common benefits clause in the Vermont Constitution if we were to cut off visitation only for one of those categories of children. So I just wanted
So Marshall, thank you. Wrap it up, please.
Okay, and so wrapping it up, I just wanted to stress that there are a lot of very important considerations above and beyond what we're seeing in Vermont that would sort of militate towards maintaining what we've been doing now, which is addressing this case by case in those few cases where we haven't been able to reach an agreed upon solution.
Marshall, thank you. Thank you for illustrating very eloquently that there are multiple perspectives on this, and that if we are going to move in a different direction, that we need to consider all of the things that you just talked about. We have 2 questions and we have 3 minutes. So James, you have, and Topper, if James takes too long, we'll have to do it later. James is
Well,
first.
As per our committee, I don't have a question, I have a comment. I'd like to know more, since there is no blanket judgment, I want to know more details about how long it's taking to go through court to
Okay, and that
what needs to be done to get quicker.
And that's something we'll have to pick up later in terms of length of time. Let me ask Topper what his question is, and if his is quickly to be answered, Marshall may be able to
No,
answer that question.
I don't have a question, Madam Chair. You asked how the committee, what were taken away from it.
Okay, I did ask that. I asked that before Marshall was able to get back on, and we're going to have
Right.
to pick up that piece of the conversation probably later, because we have now 2 minutes on our of our committee time. So if committee members will write down and think about that or say it very quickly. But Marshall, do you have a quick answer? Like it takes 3 to 5 days, it takes 15 minutes.
Right now, it depends county to county. There's counties
Okay.
that are doing it very quickly and
So
counties that are not.
So that is the same answer that we got earlier. Thank you. So in the 1 minute that we have, Topper, what have you taken away?
I
What do
think
we-
on that case, on that case by case situation, I think we have to figure out a way to speed that process up. That's one. Number two, I think we need to figure out a way to keep the kids and the essential families safe, so that we're not inadvertently allowing this virus to spread by these kids coming together.
Okay.
Those essential families
Yep.
that are in daycare. They're the 2 big things I came away with.
Topper, those are fabulous. Anyone else right now, before we wrap up, something that you want, that you took away from, that you want to make sure that we get back to? Okay, people are pretty quiet. Thank you. I mean, we've heard this was a very full afternoon in terms of both the issues around foster care, but keeping kids and families safe. And also, I think looking at both the short term, how do we both care for kids who are returning home from residential or other places, and how do we make sure that we maintain what I would say the system, much like we have, the state has been doing some pretty extraordinary work in trying to maintain the childcare system. I wonder if we need to figure out how we're going to maintain the foster and residential care system at this same time. So folks, thank you very much. As a committee, we will be back on Thursday, where we'll be focusing and hearing from the Commissioner of disability, aging, and independent living. And so sort of a dual focus of older Vermonters as well as people with disabilities. Thank you all very much. And thank you, Marshall. Glad we were your first Zoom meeting. You're welcome anytime. And thank you, committee. And I will we'll be back on Thursday. Bye.
Stopping the live stream now.